Hello, everyone. Dr. McDermott here, and I am back today to talk about hormone replacement therapy. So, before I get started, um, I think it might be in the shot here, but if you guys have been following me on my YouTube channel, you'll see that I have uh, a little concoction there that I make, my chia seed tea, which is kind of like a very watered down jello. And it's usually, these days, it's my beverage of choice because of the many benefits that it has, including, you know, adding to hormone balance. So during the this video, you might see me taking some sips of my delicious chia seed tea that I have here. Mhm. So I wanted to take care of a few housekeeping things about the podcast channel and why I decided to start to post more in the podcast portion of my channel. And the reason is that I want this podcast to be filled with positivity and to really be a channel for women to come and feel empowered to advocate for themselves, to really live their best life. And so a part of the podcast will involve women being able to call in to share their stories and whatever their health issues are, as well as to share with us their health journey and the barriers that they might be feeling or dealing with trying to get answers to improve their health. And so, I'm excited about that and feeling really good about giving women an outlet to have their voices be heard. So, without further ado, I would like to start by talking a little bit about hormone therapy and what that is. So, hormone therapy is a common treatment option for various medical conditions, including hormone dependent cancers. It's also used for transgender hormone therapy, as well as for individuals with reproductive disorders. So, it is used for many different conditions, and of course, as well as menopause. The specific side effects of hormone therapy can vary depending on the type of hormones used and the individual's unique response to treatment. And so today, I will be focusing specifically on hormone replacement therapy, which is also called HRT, the acronym for it, for hormone replacement therapy. And I will be discussing the good, the bad, and the ugly with using HRT. Of course, if you're a woman in the perimenopause and menopause phase, you're accustomed to hearing, HRT and, the advantages and disadvantages. For some of us, that is, something that we're just starting to hear being talked about, or maybe there's an ad that you've seen on Facebook or Google, because Facebook, Google, and all these different social media channels, they start to follow you around the minute you express any interest in anything, right? And so it is also the same for hormone replacement therapy. I feel like I'm being followed around these days when I'm on social media. I see things popping up for hormone replacement therapy because, of course, I'm in that age group. And like most women, in this age group, we start seeing more and more things for hormone replacement therapy as well as menopausal symptoms. And so, I thought it would be good to talk a little bit more about that and the potential benefits and the potential side effects to HRT. So HRT is, of course, a common treatment used in for the menopausal phase of a woman's life. And during menopause, the ovaries gradually produce fewer hormones, particularly estrogen and progesterone, which is what leads to physical and emotional changes that many women face. And these changes run the gamut. It's very broad and it's a very long list. But most women struggle with hot flashes, fatigue, weight gain. A lot of women have difficulty losing belly weight. And, some women might experience acne. They might also experience sleep disturbances with difficulty sleeping at night. Some women find that they experience a lot of night sweats at night, not so much hot flashes during the day, but they might become, develop more of, what we call night sweats during the bedtime hours. And so there's a pretty long list of symptoms that women experience. And I do mention a lot of the different symptoms in some of the other videos that I've done to really highlight that, for every woman, um, you know, some of those symptoms are unique. And one woman might be experiencing low blood sugar levels. Another woman might be experiencing high blood sugar levels. Some women find that they experience low blood pressures, and some might experience high blood pressures. Again, the menopause phase varies depending on the individual. And so, of course, when I talk about hormone replacement therapy or HRT, it's again, it's different for each person, and it's really important that you explore all the potential options when you are thinking about hormone replacement therapy. So, the what is the point of hormone replacement therapy? Well, HRT replaces declining hormone levels in the body to alleviate menopause symptoms and to improve overall your overall well-being. And so there are two types of hormone replacement therapies. There's estrogen therapy and there's estrogen plus progestin therapy. And not progesterone, progestin therapy. And so estrogen therapy is generally for women who have undergone a hysterectomy, which is essentially removing the uterus. And so estrogen therapy is generally designed for women in this group because they no longer require progesterone. And it involves taking estrogen only. And it can be, it's available in many forms. It's available in pills, patches, gels, creams, and vaginal rings. The second option for hormone replacement therapy is estrogen plus progestin therapy. And it is typically recommended for women who still have their uterus, their uterus essentially intact. And so progestin is added to estrogen therapy to decrease the risk of endometrial cancer, which can occur if estrogen is given alone to women with a uterus. And estrogen progestin therapy is also uh, defined, or an acronym for it is EPT. And so HRT is the acronym for hormone replacement therapy. EPT is the acronym for estrogen progestin therapy. And this is EPT is also available again in various forms. So, what are the potential benefits of HRT? HRT can be, of course, effective in alleviating menopausal symptoms, although it varies depending on the individual and what their unique hormone imbalance is. Keep in mind that when I talk about estrogen, progestin, and progesterone imbalance, that is not the only imbalance that is likely to exist when a woman is in menopause. There are many different things to consider, different hormone imbalance that can also exist with estrogen and progesterone imbalance. And this is, of course, why it is important to get a complete evaluation to make sure that that you're not taking hormone replacement therapy without knowing what the other barriers that might actually exist with you, of course, improving your overall health. One of the other benefits to HRT is that it can be helpful in preventing or managing osteoporosis, which, of course, is a condition where there's decreased bone density, which can lead to a higher risk of fractures. Keep in mind also that osteoporosis can occur in men as well as in premenopausal women. And so, this group of individuals we don't necessarily associate with osteoporosis, but it is also very possible for premenopausal women to develop osteoporosis, again, depending on what their other medical conditions are. So, what are potential side effects of hormone replacement therapy? Well, hormone replacement therapy is associated with a lot of side effects, and side effects may include a higher risk of breast cancer. The another risk is that people might develop blood clots as well as heart disease and strokes. Hormone replacement therapy can also impact your mood. And for some women, hormone replacement therapy may actually alleviate mood symptoms, and they might actually feel that their mood is stabilized and that their mood is better while on hormone replacement therapy. However, it can also have the opposite effect on some people, and so it also is important to uh, consider that when you're just starting hormone therapy for someone that is on HRT, to pay careful attention to your symptoms and whether or not it's impacting your mood in a negative or a positive way. Hormone therapy can also cause weight fluctuations. And for some individuals, it may cause weight gain. For some, they might find that they lose weight while they're on HRT. And of course, this is because HRT can affect metabolism and as well as lipid profiles. That's your cholesterol levels, as well as blood sugar levels and insulin sensitivity. And so, again, just like any medication, HRT, it has its potential benefits, but it also has side effects. Another key uh, thing to remember is that it's HRT might not be for everyone. For some women, HRT is not an option for various reasons. HRT is, uh, of course, may play a role in increasing one's risk to breast cancer. And so, if you have genetic predispositions to certain cancers, this might be and this might not be an option for you. And so, what are other options? What is an alternative to HRT if HRT is not an option for you? Well, I like to take people back to a time where, we're all kids, right? And if you're someone in the menopausal phase of your life, you can take yourself back to that time when your grandmothers and older women in your family were, aging into that phase of menopause. And if you go back and you think about it, what was their experience? Do you recall if they had the same complaints of you that you have? Do you recall, you know, them experiencing menopause with dread or just feeling the weight of that phase of their life? Or do you recall, them going through the menopause phase with ease? Well, for me, when I go back to that time, for my grandmother and my mom, and the older women in my family, I don't recall them going through the menopause phase, with the same dread, the same frustration, the same severe symptoms that I believe women are currently experiencing in our time. And so, uh, my uh, inclination is that they seem to have weathered the phase of menopause better than a lot of women are now because of lifestyle practices and what their diets were like, as well as their stress levels and environmental factors. I believe that that time and that phase for older women, our family members and our friends and people that we know, that they did a lot better, primarily because they went back to basics. And so the alternative option is to go back to basics. Alternative options that are available for managing menopausal symptoms include lifestyle modifications, non hormonal medications, and complementary therapies, including supplements. Of course, these options can be, explored based on individuals' preferences, as well as what their medical conditions are, what their risk factors are, and potential genetic predispositions. And another aspect of this is looking to the holistic approach, which has been very successful in helping a lot of women and just helping people in general with different health issues. And so, I am here to say that if HRT is not an option for you, there is hope for getting, the answers that you are seeking and feeling better going into the next phase of your life. It is very important to lean in and feel empowered in this phase of your life. Ask questions and put your health first. You deserve it. And, for me, going through this phase of my life, I feel like, I went through a point where uh, I, felt like, wow, it's here, it's arrived. And as a physician, navigating the system, I think a lot of people feel like, oh, okay, well, you're a physician and you know the system, and of course, that means that the this phase of your life should go a lot smoother for you. And of course, there are benefits to that. But, the other aspect of this is that conventional medicine, in conventional medicine, we look at specific things, lab tests, and various other things, consider various other aspects of a person's life when we are coming up with a plan. But the holistic approach looks at um, it's a wider stroke with coming up with a customized plan for each individual. And it's a nice fusion between conventional medicine and alternative therapies to partner with people to not only get them answers, but to find a solution that better suits them. And so, I want this podcast to be just a space for people for women to really embrace menopause in a positive way, because I feel like most women are approaching it with dread, right? um it's this dreadful phase where women are feeling lost and feeling like they're not getting the help that they need. And so I want this journey for women to be a time where we're just feeling better about the process and feeling empowered about, the process. And as time goes on, like I said, the idea is to incorporate more of, get women on to share their stories and to really embrace this part of our lives and to enjoy it and make it fun and to not see it as a hindrance, but for an opportunity for us to grow in our health journey and just make it the best phase of our lives, which I really believe that it can be. So I hope that this was helpful, and please leave your comments, and I will see you guys in the next video. Take care.